Acne. Excessive sebum production. Post-steroid acne is a skin condition that occurs immediately after steroid use. Usually, acne is an inflammation of the sebaceous glands of the skin and hair follicles. Bacteria, in combination with other factors, cause inflammation of the sebaceous glands. Post-steroidal acne occurs in about 50% of people who use high-dose anabolic steroids in bodybuilding. High doses of testosterone can also contribute to acne. Post-erythematous acne most commonly appears on the chest. It can also locate on the face, neck, back, and shoulders. Symptoms include open and closed comedones, small red nodules, white or yellow spots, large, painful red papules, cyst-like swellings. Stretch marks. Stretch marks are linear, parallel, or radial bands of abraded skin, well demarcated from the unaffected area, scar-like in appearance. Stretch marks are the bane of men who have decided to sculpt their physique too quickly. This is when a rapid increase in muscle mass occurs, which is not matched by the stretching of the skin. Stretch marks most often appear on the biceps, shoulder girdle, and sometimes on the sides, knees, and thighs. This is facilitated by taking nutritional supplements and, to an even greater extent, steroids. Excessive baldness. Anabolics also have an adverse effect on the state of our hair. Their use can cause androgenetic alopecia. Some of the agents described can turn into DHT, or dihydrotestosterone, which is a derivative of testosterone. The thus disturbed hormonal balance in men who are predisposed to androgenetic alopecia can cause miniaturization of the hair follicles and thus accelerate hair loss. Excessive body and facial hair in women. Hirsutism is an endocrine disorder and is the occurrence of excessive hair in a woman in places where it does not normally occur. In ladies suffering from this condition, hair appears in places where it normally occurs in men. Hirsutism is a consequence of hyperandrogenism, i.e., excessive amounts of male hormones. Excessive hair on the back and shoulders in men. Excessive hair on various parts of the body where it does not normally occur is the result of excessively high levels of testosterone, which athletes take by injection. Gynecomastia. This phenomenon involves the accumulation of fatty tissue around the nipple and the formation of a layer resembling a woman's breast. Gynecomastia is a common side effect occurring in men who regularly use androgenic drugs. Androgenic drugs help to build muscle mass and increase pounds on the scale, but they disrupt the hormonal balance. Through the composition of the drugs, the level of estrogen in the body increases and the amount of testosterone produced decreases. Normally, the body of an adult male produces 100 times more testosterone than estrogen, but as a result of drug treatment, this ratio is strongly disturbed and produces visible effects in the form of male breasts. Enlarged mandible. Wide, protruding, unnaturally distended jaw. Gaps between the teeth, pimples. This is the typical face of a person who uses doping. Rapid increase in muscle mass. Steroids deliver active substances with anabolic effects to the body, which is why gains in muscle mass can be seen just a few days after starting a cycle. High testosterone concentrations result in rapid gains in muscle mass. Strongly drawn muscles. Testosterone increases the anabolic potential of muscles so they grow bigger than what is written in the genes. Steroids also increase the synthesis of phosphocreatine, which stimulates the reproduction of ATP, a compound used by muscles to stimulate work and therefore de facto to build musculature. The more of it there is in the body, the stronger and more resilient the muscles are. Another advantage of steroids from an athlete's point of view is the storage of glycogen in muscle cells, which also leads to an increase in muscle volume, size, endurance, and strength. Visible veins. Vascularization, also known as wiring in bodybuilding circles, is another way of saying vascularization, which is the process of making the veins as visible as possible, accompanied by having very low levels of body fat. The growth of muscle mass causes an increase in blood flow through the muscles, resulting in a visible enlargement of the veins. Large difference between upper and lower body. Large disproportion of the upper body compared to the lower body due to an unnatural rate of muscle mass gain in the upper body. Effect of a distended stomach and intestinal hypertrophy. This is most often the result of growth hormone or insulin use. The result is an increase in the size of the intestines, making someone look as if they are pregnant.